Okay, so this is about some more case management, stuff. But documentation is CYA. Goal, identify the elements of clinical documentation. Clinical process involves, you will see this again, but this is the process you need to integrate this semester. So utilizing assessment tools to begin a conversation and to support diagnosis, assessment, biopsychosocial, and clinical CD evaluation construct together, leads to diagnosis, treatment plan includes intervention strategies, progress, and relapse and independent recovery plan. Some challenges. Though you believe you are helping, they may not be doing nearly as well as you think. Clients tell you false truths when reporting progress. How clients are doing in sessions is not necessarily a reliable indicator of how they are doing outside. All this means is that you must have humility and use caution when it comes to assessing the outcomes. Some assessment tools are used observation of behavior, reports by others, and having a client rate their outcomes. Other outcome measurement strategies, self-monitoring, journaling, progress notes, goal setting, recording progress through daily or more regular ratings, and evaluation forms. Oh, so this is two purposes why documentation is so important. One, facilitates best possible outcomes and services for the individual. Providers cannot be expected to remember from one person to the next or 1 week to the next. Documents the level of care provided. Since the provider is being paid, they need to demonstrate what they are being paid for, and if the provider is providing a service due to unavailable service, that is not exactly what the person needs. What documentation is needed? Main set standards by licensing organizations. If the provider is in private practice, payers, insurance companies, Medicaid, etc., sets requirements. Purpose is to demonstrate progress, increase access to referral services and protection for both parties. Not written, it didn't happen. Typical records include identification and contact information, assessment annually, a point in time, not always up to date. Summary is the most important section. Treatment plan, accountability for action and interventions taken. Progress notes relates directly to the intervention and the treatment plan. Contains accountability of the time billed. Real-time observation, mental health condition, action towards treatment, and supports future references such as court. Releases, supports your confidentiality and permission for what is released and to whom for what purposes. In addition, tracks what is released and to whom when. Informed consent, risk and benefits of treatment, etc. Agreement of payment / financial obligations. Rubber hits the road. There are two areas that are key. Work within your competencies. If you come across diagnosis, situation, topic, treatment modality, etc., that you are not confident in or competent in, you must refer to another more qualified person. You are going to say, well, of course, but there are many reasons I'm spelling this out. Treatment approaches, modalities, interventions, etc., must be appropriate to symptoms relief and evidence-based for that issue. Documentation must support your interventions. If your assessment does not point to an issue that you document it may not be a covered service. Example, person wants a driver's license, so your progress note states action you took, but there is no documentation that the client desires a license. If you document on an issue that you are not qualified to address, this is working beyond your competency. Example, if you are not qualified to discuss substance use disorders, not assessment, but in a treatment way. So why is this so important? State and federal audits, court testimony, progress of the treatment, support reimbursement of services, accountability, client review, and other. Whenever there is question Ask your clinical supervisor, document in chart or private note. So, SOAP. You want to be subjective. This section contains information relevant to what the client reveals in the session. This may be the client's chief complaint, presenting problem, and any relevant information. This information may include direct quotes from the client. This section also includes things discussed during session. For example, you may have discussed your client's complaint of not sleeping well and sleep hygiene. Use words like discussed or talked about or reviewed when describing things talked about in session. O, objective. The objective section contains factual information. Such objective details may include things like a diagnosis, vital signs or symptoms, the client's appearance, orientation, behaviors, mood, or effect. For example, client is oriented ×4, person, place, time, situation. Client appears disheveled. Assessment. This section is the place where you as the clinician document your impressions and interpretations of the objective and subjective information. This documentation may include clinical impressions related to factors such as mood, orientation, risk of harm, as well as assessment of progress towards goals. Here you want to describe your impressions. For example, client appears to understand the new goal. And then plan. This section documents what the next step is for the client. What do you as the clinician plan to do with the client at the next session? This is also a place to document things like the anticipated frequency and duration of therapy, short and long-term goals, as well as any new goals. Be sure to note any homework assignments or tasks you've given the client. And finally, some tips for writing progress notes. As with any clinical documentation, you want to be sure you are including pertinent information. You also want to avoid errors that can at best be annoying and at worst place you in legal jeopardy. First, breathe. No therapy note is 100% perfect. Depending on who looks at it, there will always be something that could be written more clearly, more detailed, less detailed, something. The key is to write clear, thorough notes in a timely and consistent manner. Here are some tips for writing solid progress notes. Write your note as if you were going to have to defend its contents. Use clear and concise language. Avoid using slang, poor grammar, and odd abbreviations. Pay attention to spelling, person, and tense. When quoting a client, be sure to place the exact words in quotation marks. Keep your notes short and to the point. Be clear and complete. Avoid expanding beyond what is required for each section. Be mindful of correct dates, times, spellings of names. Avoid making subjective statements that cannot be substantiated when making subjective statements, including pertinent evidence. For example, client appears anxious, add evidence by wringing his hands, excessive tapping of fingers, hyperventilating. Never ever alter a record using any type of correction, eraser, tape, fluid, mark outs, or scratch outs. So that's it. Thank you for listening.